Dear friends, my name is Dr. Arun Panda. I am a craniomaxillofacial surgeon, and in this video, I am going to be explaining all my friends who are surgeons and who wish to do a fat grafting, how to do it and what is the basic equipment set that is required. For my friends, I have designed a set of instruments which can actually help anybody to do a fat grafting, right from taking and harvesting fat from the abdomen, flanks and the thigh and then transferring it to the face, or if you wish to do a submental liposuction and we want to do it in a very simple way wherein we can easily do the procedure without much of the equipments. Here is what I have designed and made it in such a plan that it can be easily done and performed with minimum amount of instruments here. Now if you can see here, I have designed a set of instruments which is going to help us in the entire procedure of harvesting fat from the flanks, abdomen, thigh and transferring it onto the face, or we are doing a submental liposuction. Now I'm going to be explaining step by step how we are going to be doing it, how do we do it, and how this simple kit is going to help us in performing the whole procedure. Now there are two things. When we want to transfer the fat from the flanks, abdomen and the thigh and we want to transfer it onto the face, we actually require two cannulas. Okay, now this is my two cannulas, which is diameter of this is about 2 millimeters and the length is about 16 centimeters. The length is 16 centimeters and the diameter is 2 millimeters. Now what we do here is basically, if you can come closer and see here, there are two designs. This design actually helps us to inject the tumescent solution into the area from where we are going to be harvesting the fat, and this design actually helps us to harvest the fat from the place where we have injected the tumescent solution. So basically these are the two instruments which are going to help us. One is basically putting or injecting the tumescent solution and the other one is for harvesting. Now what is important here is when we are either injecting or we are harvesting, is we use a lure lock syringe, which is a 10 ml syringe. Now what we have done here is we have designed it in such a way that when you put the lure lock, it snugly fits and there is no chance of any leakage from here. And once we have done it, we start pushing the tumescent solution. So once we have put the tumescent solution, we wait for 10 to 15 minutes and then we start harvesting. In the same way, we attach the lure lock 10 ml syringe into the cannula, and then what is important here is once we have created a negative pressure, we are going to be using this kind of a stopper. So what I'm going to be doing here is, so this stopper actually plugs in here and this holds a negative pressure. Okay, so now once we have created negative pressure, the moment we start doing this maneuver, it starts sucking inside and the entire fat comes here. So now we have understood how we are going to be harvesting the fat. So once we have harvested the fat and we have taken out, so what we are going to be doing is we have a set of transfers. Now if we want macro fat, we will be transferring the entire fat through this transfer 2.5 millimeter through to another syringe once or twice, and then we will be transferring it through the 2 millimeters, and that's it. We have created macro fat. So the macro fat should be used in areas where we want bigger volume, like the cheeks area. So here we would require a macro fat. Now you want to transfer it into micro fat. What we will be doing is we will be passing it through the 1.5 millimeter transfer. So once we have transferred through the 1.5 millimeters, we have created micro fat. So the micro fat can be injected into the lips, into the tear trough area, and this helps us in creating a good volume, but the fat is not very thick. Okay, now you want to do a nano fat or the stromal vascular fraction. What we do is we transfer it through the 1 mm transfer multiple number of times, and we have passed it through that, so all the fat cells are gone and what we are left out is the stromal vascular fraction or the SVF, and that is nano fat. So the nano fat should be injected only onto the skin for rejuvenation and helping us in reducing the pigmentations, etc. Okay, so that is what we have done. That is how we are going to be transferring. Now if I want to use a macro fat or the micro fat, macro fat can be injected. We should not be using a needle here. So what we are going to be using is basically a cannula which has a single opening on the lateral side, and this will not be kind of damaging any blood vessels. So once we have taken the fat, the macro fat or the micro fat into the syringe, we adjust it and snugly fit this. Now imagine this is my face wherein I want to inject into the cheek area. I will be making a small port of entry with a 18 gauge needle from the angle of the mandible, which is not seen at all, and from there I would be entering into the cheek area and we will be depositing. Now the advantage of using this 10 centimeter cannula or depositing cannula is that from one single point of entry I can go into all the areas and I can keep on depositing here. So this is going to help me an injection cannula to inject the fat. Since it is 2 millimeter, we can inject the macro fat and the micro fat both with this. Okay. So this set is going to help me. These 3 cannulas are going to help me in harvesting the fat from the abdomen, flanks and the thigh, and also transferring it onto the face. Okay. Now, for example, you want to do a submental liposuction because many patients come and complain that I've got a double chin and I want to take care of a double chin. We don't require another huge set of armamentarium. All we require is set of these 2 cannulas. In the same way, what I have done here is, if you can see here, this is a 10 centimeter cannula with a 2 millimeter diameter. In the same way, first we have to use this tumescent solution with this kind of a designed cannula, and then we have to harvest it. So with this kind of a cannula, which is again a 10 centimeter cannula. So the advantage of using a 10 centimeter is basically I can approach any part of my neck through one single point of entry from the submental crease, which is actually not visible for any patient post-operatively. So I make a small point of entry here, and through that I push this tumescent solution here inside into the supraplatysmal plane. Through this, once I have done it, I push the supraplatysmal into the supraplatysmal plane. The tumescent solution goes in, and post-operatively, post that, what I will be doing is, again I will be mounting this cannula which has got multiple oval holes here, and I will be creating a negative pressure. Once I have gone in, I will be creating a negative pressure, and I will be using this stopper here like this. Once I've created a negative pressure, all I have to do is just go and do this submental liposuction into the. So one point of entry, I can go to the lower border of the mandible here, all the way here, all the way here, and into the areas which is, from one point of entry, I can approach the entire neck and I can harvest the fat or take out the entire fat, which is going to take care of my, the neck fat. Okay. So friends, what I have done here is, as I mentioned earlier, this is the small design change which I have done. So this is going to help me in harvesting fat from the abdomen, flanks and the thighs and transfer it into the face for fat grafting. And these transfers are going to help me to do macro fat, micro fat or the nano fat. And these 2 cannulas are going to help me in doing a submental liposuction. So if you have any query, you want to know more about fat grafting and how to do submental liposuction, please get in touch with me. And Trinity Aesthetics Academy is that center for excellence for teaching and training all my fellow surgeons in for hair transplant, for facial aesthetics, for fat transfer, for facial implants, for facial feminization surgeries, and non-invasive, minimally invasive facial aesthetic procedures. You can get in touch with us and I'll be more than happy to help you out. Good luck and take care.